Hello everyone, I'm Dr. Hamza Al-Ashwah and we have today another case in our playlist, the examination frame related to MRCS Part B examinations. Today we have shoulder case, okay? And we have our frame after introducing the room of the examinations. You have to wash your hands firstly and introduce yourself and confirm the patient details and explain the examinations and gain the consent and ask about the pain and also ask for the exposure and offering the chaperone. This is what? This is orthopedic case. So we have to look and also feel and moving and doing what? A spatial test. So we have another page. Okay, this is one. So we have to doing some special test and finally we have to thank the patient and wash our hands again. So start by details. Okay, by details we firstly wash the hands and introduce yourself as we say good morning, good afternoon. My name is Dr. Hamza. I'm one of the surgical doctors. Could you please confirm your name and age for me? Okay, and explain the examinations. Today we am asked to examine both shoulder joint, which including lock, feel, move, and doing some special tests. Was that okay with you? Okay, and don't forget to ask about what it's pain. Do you have any pain at the moments? Okay, after that, we have to expose the whole joints. We have to expose. Could you please take off your shirt? Okay, and the examiner with you as chaperone. After that, we go for the looking. Okay, and the looking, you have to inspect the patient from front. For what? To inspect the head and the neck posture, to inspect the symmetry of the shoulders, to inspect the deltoid wasting, to look at the ligament of the shoulder guard, to look at the scarring, okay, and also inspect from the side for any scars and also inspect from behind. For what? For scars, deltoid wasting, alignment of shoulder guard, trapezius wasting, and also the paravertebral muscle wasting, and also scoliosis and winged scapula. Okay, don't forget to inspect for winged scapula, lung thoracic nerve injury. Take care of this one. After that, you have to go for the feeling. Don't ask about the pain. I forget to write it, write it in this. Okay, but don't forget to ask about the pain before touch a patient. Do you have any pain at the moments? Again, okay, and go for to assess the temperature, tenderness, shoulder girder. Okay, what is the shoulder girder on both sides? You start by sternoclavicular joint, clavicle, acromioclavicular joint, coracoid process, head of humerus, greater tuberosity of the humerus, trapezius, and biceps tendon. After this, you have to feel the borders of a spine of a scapula. You have to go for the moving. First, active movements. Shoulder abduction and external rotations with elbow flexion. Okay, and the shoulder internal rotations, shoulder flexion, extension, shoulder abduction, shoulder external rotation and internal rotations. This is actively movements. Okay, and You have also to assess the movements of scapula. Okay, after this, you have to assess the passive movements. Passive shoulder flexion, shoulder extension, shoulder abduction, shoulder adduction, external rotation and internal rotations by passive way. After this, you have to do some special tests. Empty canis test, painful arc test, external rotation against resistance, internal rotations against resistance, near sign, scarf signs. After drawing this, thank the patient, thanks for letting me examine you. Do you need any help to get dressed? And finally, wash your hands and go to doing small discussions with examiner. By this systematic frame, you will collect more marks. I promise you. Thanks for your listening with you, Dr. Hamza.